With all the worries about coronavirus and your urgent referral to the hospital, it is understandable that this is a very difficult and concerning time for you. You may feel well supported, but this video has been designed to hopefully answer some of your questions.
An urgent 2-week referral usually means that you will have been referred to a hospital specialist. This is so that your illness can be diagnosed and treated quickly and effectively. Whilst this does include the possibility of cancer, the majority of people referred in this way do not have cancer.
During the COVID-19 pandemic, you're likely to be offered a telephone or video appointment as your first contact with the hospital. The timescales for your first contact may vary during this time. Please make sure that your GP has your correct address and your telephone number, including your mobile number.
The hospital team will explore any concerns further. You may find it useful to write down any questions you want to ask during your appointment and take them with you to refer to. The specialist team will give you a lot of information. Many people find it helpful to take a friend or relative with them.
The hospital team may well decide that they need to see you in person. At the moment, hospitals are restricting visitors to their sites in order to protect both staff and patients. So if you have an appointment, you should attend alone, or if you're unable or prefer not to, one person can accompany you.
The next steps are always worrying, but the hospital team will advise and discuss with you any information about the tests they may wish to book for you. This may mean attending for those tests on an alternative date so that you run a lower risk of developing COVID-19.
At our 3 hospital sites, Mid-Essex, Southend and Basildon, we have set up the Cancer Support Line. This will help be a link between your GP and your local hospital. This is manned by us at the hospital, and we have access to your specialist doctors, nurses and teams that support you, so can ensure that you get to speak to the right people about concerns that you have. It's important to remember that this is not an emergency number, so please contact 999 or your nearest A&E in light of an emergency. The 111 service is also operational.
If you have been diagnosed with cancer, treatments are still going ahead. These include chemotherapy, radiotherapy, and surgery. There will be close monitoring and extensive discussions amongst various health professionals about what is the safest option for you.
In short, there are lots of possibilities. It's important to reiterate that most patients referred in this way do not have cancer. Our teams in the hospital are working harder than ever to ensure that you get a diagnosis and treatment for those that need it as quickly and as safely as possible. In addition to the helpline number listed, support is available through Macmillan here. Thanks for watching.